What does this mean for children in that age group right here in Utah?
Yeah, we are still waiting for that final CDC approval. But news specialist Alex Cabrero says this recommendation is something Utah's Department of Health has been anticipating. Alex?
That's right, Matt. In fact, University of Health medical doctors as well as doctors with Intermountain Healthcare are having a press conference right now speaking about this FDA approval. But Matt, as you mentioned, this is only the first step in a four-step process to get the final approval. Even still, when that final approval happens, which is expected, Utah leaders want to be ready. Even though the COVID vaccine has been out for about 10 months now, it has never been recommended for children ages 5 to 11. However, that process got its first approval today.
Many of you heard the myth that is absolutely 100% false, that kids aren't severely affected by COVID.
Doctors with Intermountain Healthcare and University of Utah Health talked about the FDA approval for children today and how the plan now goes to the CDC and why they feel vaccinating children ages 5 to 11 is a good idea.
The good news is that with this lower dose that we use for kids, the incidence of fever and chills was substantially lower than it is in adults, but it still happened, and it's still something we have to deal with.
In Utah, there are about 365,000 children who are 5 to 11 years old who will be eligible for the pediatric version of the COVID vaccine. Utah has already ordered 109,000 of those doses, which will be shipped to health providers across the state beginning this Friday.
These Pfizer pediatric vaccine doses is packaged in a different concentration. So pediatric doses are 10 micrograms as compared to the adult doses, which are 30 micrograms.
You also just can't take a smaller dosage of the adult vaccine because of the different concentration levels. We also asked Utah's immunization director about the willingness in Utah for parents to have their children vaccinated. Following the most recent age group, 12 to 18, currently stands at 61% receiving at least one dose.
The response to that age group was surprisingly pretty good. It started out slow and then gradually increased. So our anticipation is that the 5 to 11-year-olds will probably follow that same pattern.
Now, if everything is approved as is expected, Utah children ages 5 to 11 years old could start getting the vaccine sometime in the next couple of weeks.